If you don't feel safe trusting a body that is still pushing OxyContin, which caused the opioid epidemic. Do we know how many people have died from that? And that's been years. We could have stopped that ages ago. But the FDA still approves it. You can still get OxyContin from your doctor. So, yeah, there's no reason to necessarily trust the FDA. I'm mildly short, but I will stop at 17 seconds to go. Woo! Okay. Oh, sorry.
That's okay. No worries.
I was excited to sit down.
I hear you.
Hello, my good man. Thank you. No, I thought it was funny. We both referenced the same thing. I was like, I looked at best colleges too.
Okay. In 5, 4, 3, 2, 1.
I'll let you go first since I talked a lot about your stuff.
Okay. Well, I just wanted to ask you, where you just talked about 80% vaccination, I just wanted to ask, like, where you got that from, like, when that research was from?
So the last time that I accessed that information, that was on UNT's website. I'm fairly confident it was UNT's website in August of this year.
I just wanted to ask, just to, like, make sure it was, like, up to date.
Oh, no, you're good. And then the best colleges thing, I attempted to have like the actual number. So it's a little bit over 1,000 of colleges who have vaccine mandates. However, again, as Macy has stated, the amount of COVID cases are relatively the same. And the amount of hospitalizations has actually been going down over time instead of up.
Can you, like, kind of restate your phrase about how, like, was it the government can't inject something into you without your consent?
Oh, yes, okay. So, Washington versus Harper, US, 1990. You cannot forcibly inject medication into a non-consenting person's body because that interferes with that person's liberty.
Well, first that goes over in the fact that, like, we're not against exemptions, so I feel like part of exemptions is part of, like, the non-consenting, because there are people that are exempted. But also in a 1905 U.S. Supreme Court case, Jacobson versus Massachusetts, the president has the authority to create federal vaccine mandates through checks and balances and lack of clarification through the Constitution. There's nothing saying that federal mandates cannot be created either. In the 1905 lawsuit specifically, the court upheld that states had the right to require vaccinations among smallpox during epidemic.
So, quickly, that's cute, but this is 1990, that's 1905.
Yes.
So there's an 85-year difference between those two regulations. So yes, 1905, the president was allowed to do this. However, in 1990, if you do not consent, you do not get it, which distrusting of the FDA counts as non-consenting.
But
So
there's
that
nothing
should-
up to this point that annuls that.
Time.
Oh, you're doing great.
All right, Megan, just good. Give me a thumbs up when you're ready. All right, 5, 4, 3, 2, 1, go.
We on the affirmative see no problem with requiring COVID-19 vaccines on college campuses in most circumstances. As my team member brought up, we would allow exemptions as other vaccine mandates would. COVID-19 is a disease that is highly transmissible, serious, and often deadly. So yes, cases may be going down, and yes, maybe people aren't dying at the rate that they were, but people are still dying. That is still what's happening. We're still spreading, and we're still getting other people infected. But luckily, the vaccines that we have right now are safe and effective against the variants we have, such as the Delta variant. And I just want to point out that since we found the first case in the United States back in January 2020, we have 11 variants. That's how bad it is, okay? But like I said, the vaccines that we currently have can to a certain degree protect us from serious effects such as hospitalization and death. And currently there is no equally effective alternative available to protect public health. The vaccine mandates are put in place to help protect the most vulnerable among us, including people with disabilities and fragile immune systems and members of lower income communities hit hard by the diseases. Public colleges involve diverse groups of people with different backgrounds from our own, and anyone who may fall into a vulnerable group, such as these, should feel safe when coming to campus. Vaccine requirements also safeguard those whose work involves regular exposure to the public, such as our very own professors, doctors and nurses at our own student health and wellness center, the bus drivers, our food service employees, and by protecting people from the disease's worst effects, like I said, the vaccine offers the promise of allowing us to return to life as we knew it, or normalcy if possible, in classrooms, gatherings, and events that every college student should get the chance to experience once it is safe for everyone to do so. Yes, breakthrough infections may still occur, but again, we cannot stress enough how vaccines significantly reduce the likelihood of hospitalization and death. The fact still remains that those who are not vaccinated run a higher risk of infection. We brought up liberties and things of that nature. So, I mean, there's no way around it. Like, people should have a right to their, to say what they want, to their bodily autonomy. But vaccines are we believe that vaccines are a justifiable intrusion on an autonomy and bodily integrity. That may sound terrible, but we all have the fundamental right to make our own healthcare decisions. But these rights are not absolute. They do not include the right to inflict harm on others. We talked about death, and in the United States alone, since the first COVID case was discovered, there have been 40.3 million cases, 766,206 deaths because of the virus and its rapid spread. We may think, well, it's slowed down now and there are fewer deaths happening daily. That may be true, but if you look at why these rates have drastically declined, it is because of the vaccines. There was nothing else that was helping us. The masks back in 2020 weren't doing us any good. I also really want to touch real quick on the fact that it was mentioned that 80%, there was like an 80% vaccination rate here on campus. As it was stated, it was like back in August. I just want to say that recently, so here on our very own campus, there was like an incentive program required. So, people were getting vaccinated. And, some of the incentives were book stipends, parking passes, and $24,000 tuition financial awards. All in all, the total number of prices that were given were roughly around $985,000 for students who got vaccinated. You just had to prove that, right? But there was a statement released by President Neil Smathstrex on September 28, 2021, which you can find on our UNT website, and it states, about 73% of our faculty and staff and 54% of our students are vaccinated. Only 54% of students are fully vaccinated on our very own campus. But yet we don't sit 6 feet apart, and we don't participate in the 100%, we don't all wear masks when going into classrooms. So if herd immunity is even a thing, we are not there. We're not at the 70% mark. And that was despite all its efforts and the extent of that incentive program to get us all vaccinated. There are other colleges in the United States who are, like my team member mentioned, there are other college campuses that are requiring vaccine mandates. And the reason for that is simply being that they have tried other things, such as incentive programs that did not work. For example, the Case Western Reserve University in Cleveland offered
SONIA. I need a phone, I need a timer. Kind of a mess getting all my notes. Yeah.
Okay, and 5, 4, 3, 2, 1, go.
Hi, my name is Sonia. I'm going to be continuing the arguments for the negative. All right.
College campuses do not need COVID-19 vaccine mandates because it is unnecessary. Without the vaccine mandate, college students are already getting vaccinated. How quickly the FDA approved this vaccine is concerning, as the FDA can't always be trusted, and vaccine mandates are insensitive to certain ethnic groups. Without the vaccine mandate, college students are already getting the vaccine. The affirmative likes to argue that there will be suffering without the vaccine mandate, but it fails to note that we as college students are young and are less likely to die from this if we get sick. The affirmative also likes to argue that faculty would be getting sick as well, but the CDC shows that 86% of people of the population 65 years and older have gotten the vaccine. What the affirmative also fails to note is about 70% of students have also gotten the vaccine as well. Also, from the UNT website currently, UNT only has 14 active cases. The affirmative also likes to argue that only 54% of students have gotten vaccinated, but this is from September. We are now in November. As my teammate pointed out earlier, there is a 1.5% of difference of college students who are vaccinated between a college that does have a mandate in place and a college that does not have a mandate in place. According to the University of Texas at Dallas, 81% of students who have gotten the vaccine, who are attending the school have gotten the vaccine, with faculty having an 87% rate. As more bars and restaurants require vaccines, college students are more likely to be incentivized to get the vaccine. Colleges in the U.S. are starting to incentivize and get the vaccine. Student organizations are coming together to help push one another to get the shot. Ruth Hersman, student coordinator at the United Tribes Technical College, has set up a comprehensive system of reminders and incentives to encourage vaccination. Each of the students and the employees who receive the vaccinations and complete their series did get a $500 incentive and have given out t-shirts with a slogan that says educated, motivated, and vaccinated. We do personal outreach of each employees and the students on campus with phone calls, texts, and emails. From a statement back in summer, before there was a vaccine mandate in place, they reported that, I want to say, about 59% of students were getting the vaccine. To incentivize compliance with testing requirements, Becky Smith, an associate professor at the University of Illinois, explained that we have found what really matters to the students, their Wi-Fi access. We have the ability to turn off their Wi-Fi if they have been out of compliance with testing for a week or more. The affirmative argues that the hepatitis B shot does require boosters, but this is done sporadically over a period of time, starting from infancy going through childhood. The COVID-19 boosters can range anywhere from a couple weeks to maybe a year after. So are students expected to miss class after this? The FDA cannot always be trusted. As stated before by my previous teammates, they had a hand in the opioid crisis. I would also like to state, this does not mean that the FDA can never be trusted, but it showed that the FDA cannot always be trusted. Variants are more contagious, and as my teammates stated before, how will universities mandate booster shots? Will universities mandate booster shots for every variant? If universities adopt this policy, should those that aren't allowed on campus be paying the same tuition rate? Going back to variants, the COVID-19 has been around since the 1960s. There are older human coronaviruses were first identified in the mid-1960s, but have likely circulated in humans for mid-centuries. This includes from as early as 290E, and then it goes back, and then there's various variants like the alpha virus and the beta virus. We are also seeing more. We also see viruses in the UK, despite having about 9 out of 10 people being vaccinated. So does the vaccine really work against this variant? If so, how are we expected to regulate and enforce this mandate when even here at UNT they can't even properly enforce mandates and social distancing? Students are more likely to take advantage of these mandates. Also, if masks don't work, why are we wearing them right now? We have a room full of people that are wearing masks right now. Vaccine mandates are insensitive to certain groups of ethnic and religious groups and can isolate individuals from society. Some examples of religious groups that would potentially seek religious
Okay, You're in class first? Everybody actually.
Let's do it. Yeah. I'm sorry, I just hit that.
Okay. Okay, thumbs up from everybody when we're ready. 3 minutes during this crossfire. Come on, everybody, thumbs up. Awesome. Okay. Going in 5, 4, 3, 2, 1.
I would like to ask the first question. In your speech, you mentioned that this was the first case of COVID-19, but actually COVID-19 has been around since about the mid-1960s.
Right, this was in the United States. The first case that was found in the United States was from January 2020, and since then, that's when all the variants have come back.
However, scientists speculate that the coronavirus has been inside of our bodies for centuries, so why is this a big deal right now?
Because it's started spreading, because we started having all these like major
But it's
cases.
been there.
Okay, but it wasn't active or something wasn't there.
Let's be frank though, we only have 14 students on campus right now that have COVID. 14 out of how many students here?
About 40,000.
40,000.
Okay, so what's the
And
point
when
of
was that? When did you do that research? Was that from today?
That was
That's-
actually today.
Yeah, that's today.
Interesting.
So
So we should just ignore those 14 cases and possibly.
It's not that we are ignoring them, but you're also ignoring the fact that we're younger and even
We're
with the
younger.
14.
Yeah.
Yes, we
But like
are.
we said, the faculty, we can talk about the faculty and staff. These are older people.
you're not gonna be able to
We
regularly do
have,
this, just so you know.
we have all these other
Yeah, but
employees who are
about
not our
90
age.
Yeah,
We
but about
also-
90% of people 65 and older have the vaccine.
We also don't know if those 14 were
Okay, well then
vaccinated or
at
not.
at the
We can still
University
give
of
them
Dallas,
vaccine.
about 87%
And
were
yeah,
vaccinated.
that's not school. You're talking about the school.
Yeah, but it's a pretty good reference
That's the
point
thing, is that
considering
we don't know.
UTD is only
Because
about a
we don't know if
30-minute
you're
drive away.
vaccinated, not,
Because I feel like
You
that
also
would
brought up
be
the fact
very
that-
important. I mean, if y'all could.
I only mentioned 54% of the
Yeah, it
population
won't
have been
let you on the
vaccinated back in
website.
September, but the
just, you know,
data you
HIPAA
brought
laws.
was from August. So do you have
HIPAA
data
laws?
of how much
You have
of
to
the
voluntarily
college
provide
campus
that
or how much of the
information?
students on college campus are currently vaccinated?
and that also
Actually,
brings up
we don't
another
have
point,
that
because of
specific
HIPAA,
data.
you really
However, I
can't
do
know people
know
are vaccinated
she had the
anyway, unless
vaccine.
they're
She had
willing
the
to provide that
statistics, you're gonna have
information,
to
and then you're
ask about
forcing people to give up that right.
She stated it was from August. Your
Yes,
vaccine
I
was from August,
backtracked it.
correct?
I backtracked it because I realized I misread the statistics. I was looking at the overall, I wasn't looking
Right,
at
so
that.
as of right now, if you want to backtrack, we can only go based off of the fact of what was released from our very own president stating that 54% of our students were vaccinated.
Okay,
Correct.
yeah,
Even
but
though that
that
was
was
from
in September, but
14
can I ask you,
currently
do you yourself know the current?
Again,
No,
Yeah,
that
reason
is why I am going
Stop,
off based
you're
on
fine.
September. If 54% is what we have and I don't have anything else for November, then that
We've
probably
had all-
means that we don't
We've
have
had
that
all
many
these
other
weeks to
vaccines.
do all this research, but yet you can't find any more current data from today.
Because there's no other current data provided. So if it says that 54% of students were vaccinated as of September 24th on this campus.
Oh, it's also
then
not
54%
obvious
of
where to
students have
put that
been.
info, because I'm fully vaccinated, and I still don't know where to submit that.
That is true.
So-
I also don't know where to spend mine.
Right, so it's
It's
not,
being sent out to emails and stuff.
No,
So
it's
if you
not.
The
Right.
process takes at least 3 months for it to process through. I tried, and I still haven't gotten a confirmation.
Sure, then we can
email.
go back and check back in 3 months from September, but as of right now.
so what's the
that's
point of
still
having a
stands.
vaccine mandate if you can't even get people to, like, you can't even make a system where people can already prove they're vaccinated?
We have our very own student health and wellness center where they're offering COVID vaccines if you
Yeah,
want to
but
get
I also turned in
vaccinated.
my vaccination record for, let's see, what did I get? Meningitis, and
Hi.
I lost it.
Okay. All right, and Delilah.
Yeah, I forgot about it.
I'm so sorry.
My class is across the campus. Nope.
Sorry, you left this point out.
Okay, everyone gets Okay, Delilah, whenever you're ready, give me a thumbs up.
Okay.
All right, going in 5, 4, 3, 2, 1.
Okay, we have made ourselves clear. We discussed the impact of COVID-19 and the use of exemptions if we were to have a vaccine mandate. To reiterate, there are checks and balances in place, such as Title VII, which requires reasonable accommodations for vaccine requirements that conflict with their sincerely held religious beliefs. practices and observations. It's not the first time we mandate a vaccine, and the U.S. Supreme Court held in 1905 in the case of Jacobson versus Massachusetts. This vaccine is tried and true. mRNA has been well researched for over 30 years, and there are also a lot of studies to back up what it will do and what it won't do, according to the Harvard Health. And there may be a concern that the vaccine was developed rather quickly, but again, it's reapplied information. We had the equation, we just had to input the numbers. If we were to mandate a COVID vaccine, student, faculty, and staff will have some immunity, which will help keep everyone safer. And if we didn't have the vaccine, it is important to maximize the number of student, faculty, and staff who are fully vaccinated to compensate for those who are unable to. And as a result, this will help minimize the variants and the overall severity of the COVID-19 pandemic. Yeah, that's all I have.
No, you're fine. No, please.
Mason, right?
Yes.
Let's say good luck. Sometimes it takes years.
Okay, whenever you're ready. Ready?
Yeah.
Okay, in 5, 4, 3, 2, 1, go.
Hi, my name is Mason Bratcher, and I will be giving the conclusion for the negative speech. As our team has discussed, vaccines cannot compete with the new strands of the virus, and the timing of this mandate is questionable. The CDC still recommends wearing face masks and following public health protocols, as my team has mentioned. We have also cited the Delta Plus infection rates surging in the UK, regardless of vaccination status. The affirmative is right when they mention that symptoms are less severe in people who are vaccinated, but transmission rates continue to rise. I do admire and respect the affirmative's emphasis on moral obligation to be vaccinated, but it is unfair, unethical even, to blame a person's death solely on unvaccinated individuals. Furthermore, universities, like my team has mentioned, are already implementing alternatives to fight the spread of the virus. And according to Jacobson versus Massachusetts, a court case that both sides have interpreted in their favor, but the affirmative leaves a key part of that ruling out. If the goal of the law, or mandate in this instance, can be achieved by less invasive measures, then the court may well strike down the law. So the affirmative argument that the school is doing nothing to protect students is just flat out wrong. Masks, social distancing, gloves, sanitization equipment. We even have on-campus, reliable, efficient, and accessible COVID-19 testing. On top of that, vaccine incentivization programs have been implemented and proven to be successful if the reward is worth it. We compared multiple campuses with varying stances on mandates. UNT and UC Boulder had that 1.52% difference. And while it is not a representative of the national standard, it still sets a precedent that universities can successfully keep their campus safe without a mandate. So less invasive measures are working in this case. And the statistic does not warrant a radical administrative action like a mandate. UC Boulder, as well as my peers on the affirmative, have cited the FDA's swift acknowledgement of the vaccine's viability to support this mandate. However, as my team has mentioned, the FDA is no stranger to mistakes. Our team talked about the FDA's significant role in the opioid crisis when it approved OxyContin, a drug that had a notorious potential for substance abuse during clinical testing. Our team, certain groups like pregnant women, which our team mentioned, were omitted from clinical trials. You can even mix and match booster shots now. But just a few months ago, the manufacturer of your shot had to be consistent. All of the evidence presented by my team supports the concerns being raised against the FDA and other public health administrations as legitimate and not illogical. Especially when there is no other higher authority on such a matter, public skepticism is going to be volatile. Lastly, how would you even enforce this mandate? Again, Jacobson versus Massachusetts cites that a special circumstance to circumvent the law, as do other court cases dealing with this type of matter. Admittedly, a belief to get a religious exemption can be misconstrued, but this highlights that religious and other exemptions could be taken advantage of, which shows that no matter what, mandates can be sidestepped, which our team argues defeats the whole purpose of a mandate. It is just extremely difficult to request someone put aside a lifetime of cultivated beliefs for one, maybe 2 semesters of college. If the Supreme Court decides to use more concrete language in their rulings, or if they limit the special circumstances, then we would accept the legal legitimacy of these vaccine mandates. The affirmative also cited a need to return to normalcy pre-COVID times. But online classes, online colleges, as my team has mentioned, have been around before COVID. We're even enjoying the luxury of debating in this room. In-person things are happening. We're returning back to normal. In conclusion, the affirmative has attempted to paint mandates as the end-all be-all when the situation is much more complicated than that. Not only could this vaccine mandate infringe upon civil liberties, but it could be infringing upon civil rights as well. By trying to expedite the solution of the pandemic, we will undoubtedly be left with more questions. Questions that need to be answered and nuances that need to be addressed before we can adopt this policy. And that is why public colleges and universities should not adopt a COVID-19 vaccine mandate. Thank you.
Yeah, if y'all want to know.
Yes.
Oh, wait, what
Sorry,
are we doing?
I'm competitive. Our recitation never told us who won ever.
Oh, yeah, no, we never got to know.
Okay, give me a drum roll.
Y'all did
It was so much fun to debate you. I don't like debating. I have heartburn right now, but if you make it now.
I think we put it left, but y'all did it. Out of yourselves.
You guys
I enjoyed that. The crossfire had you cracking up on the inside. He's a debater, so I was like, dude, when you do crossfire, laugh.
At least it's over.
But y'all should be so proud of yourselves. I'm proud of you guys, even though I don't have y'all in my personal reservations. You know, I kind of see you guys on Tuesdays sometimes. This was not easy. Y'all survived, y'all did it, y'all stuck to the end. I don't know what you have planned for today. Get some self-care going in there. Enjoy yourself during Thanksgiving, and thank you guys for being awesome to my other members. And we really enjoyed having you guys. See you all. I will see y'all Tuesday.
Also, hi, if y'all want, like, my boss is going to figure out how y'all feel after that, so.
Oh, that's fine.
I'm gonna get pictures of you guys now, my goal is to get pictures of all of us together.
Yeah.
Okay. Is that alright? Or we can do it together after this.
Good job.
Thank you for coming, it's welcome.
Did you say we're holding them? I want to take pictures with you. I feel like I'm holding them. But if you don't want to take it, you have to. I will make it. I think that'd be fun.
Do you want to take a picture? No, I'll give you 1 second. I have to stick this in the camera.
Okay. Oh, yeah. Oh, it's still recording. I'm gonna go ahead and stop it.
Yeah, I have.
Wait, I'll let her stop it. I don't want to get it.
Basically done.
You signed in with the extra credit, right? Okay. Look what I did.
Did I turn this off?
No, not yet.
How do I turn this off?
Just press the record button again.
Like,
You to stop recording.